every family, they either have a family member or a neighbor or some other relative or a friend that has a mental disorder. You know, I've been fairly open in talking about my father who had a panic disorder and the impact that had on our whole family. My job as county judge is to protect the community. We need to put resources into mental health like we do into any other healthcare issue. It's my passion. We have to have groups like Vecino. These people are already doing in the neighborhood what we need done. We just need to help them to expand their operations. I don't know what we'd do without them.
This is an enormous step for Vecino to focus on mental health and behavioral health issues. We've grown so far and we've done great things, and we need to continue to grow and we need to continue to expand.
Mental health is like any of our programs. I mean, we want it to be self-sustaining. It's all about prevention, and prevention is education. So here at the Denver Harbor Clinic, and also at our Airline Children's Clinic, if a provider feels like there are some mental health counseling issues with a patient or a child, they'll contact our mental health director. She'll come down and she'll speak with that patient directly. It's really just more of a team approach, a holistic approach to that patient.
Poverty is a tremendous stressor in the population that we serve. People come in and they're in tears a lot of the times, just so stressed and frustrated.
We're having a little bit of a longer wait than we would like to see the mental health counselor because there is so much need in this population, in this community.
Sometimes we see a lot of physical symptoms and people come in because they have headaches or because they have stomach problems. And it's not something physical, it's just their stress manifesting itself. So by addressing those issues and learning different ways to manage their stress, then that helps the physical symptoms.
We have individual therapies and we have clients that we've seen for years at a time. What we do here is we change the way people see the world so that the individual can start viewing their world from a different perspective. And that's what creates long-term change. We have group therapies, and usually those clients, they learn how others manage their stressors, and the patient becomes the therapist in a sense. They give back.
I was trying to find peace. I had 4 very bad relationships that were very, very abusive. I fought a battle with suicide up until I started the counseling here at Vecino. I never thought I could be in a group. I thought, I'm so messed up. I go into a group and they're gonna be shocked. They're gonna say, oh, this woman's nuts. But now I see in their weaknesses my own weaknesses and where I can strengthen myself. They find the same thing in me. We touch each other's lives and help each other heal.
Really, it was an eye-opener for me. I mean, people really needed that service. We do a community needs assessment every year where we bring in stakeholders, and the number one need, the last 2 or 3 community needs assessments that we've talked about, has been more mental health services, specifically for teens. And so we were fortunate enough to get a collaboration with Reynolds Middle School. That program's been very successful, and we're trying to expand it.
When I got here, I just noticed that there was a big void for our social, emotional, health of our kids. And I met Daniel and some others in Vecino, and I asked them about it. Then they came up with the idea of having somebody come here in a real comfortable environment at school, and that's how it all came about. And they've been just a huge asset.
I am the counselor who's in charge of the McReynolds program. So I work here 3 days a week and over there 2 days a week. There's a lot of behavioral issues, kids are misbehaving. So by being there, you can be that person who helps them set goals and think about their future, not just the here and now.
What happens is when these kids are there and they don't have these mental health counseling needs met, they become, problem students. And the chances of them dropping out are higher, which is bad for the economy, bad for the community, just bad for everyone.
They fall behind in school, they get into criminal activity, and it's not because they're a bad kid, it's because they have this condition. And if we can catch it early, then they can live a very productive life.
That is where we're headed, I believe, in behavioral health services. Not only being here to provide support to the patients that come to see the physicians. We are right here where the children go to school. Perhaps with a few more tools in our toolbox, we would become much more dexterous at being able to handle the population that we in fact are already serving.
The more that we can do, to help that family become stronger and more knowledgeable, the better off our communities are and the city is. I think that's good for the economy, that's good for businesses, and that's good for society.
You just have to go back to, what are we doing to serve the people? Anything we can do that helps groups like this continue providing the desperately needed service, we need to do it.
It's been quite a journey. I've learned that being strong is okay and loving yourself is okay. That's come from here, from Vecino. So I'm very grateful for that.